Hello, good evening, everybody. This is Mrs. Somo Labake, do Father Ibi of Labake Organization. I hope you are all doing well and staying safe. I'm bringing you health talk, health information. I'm not making any diagnosis. Most of the information I'll be sharing with you tonight is from CDC. I got them from CDC and some textbooks. So, the topic today is going to be on cold versus flu, differences and similarities, and flu versus COVID-19, differences and similarity. So what are the differences between a cold and a flu? Both are respiratory tract illnesses. They are both respiratory tract illnesses. They are both respiratory tract infection. They are caused by different viruses. Both have similar symptoms. They are very, very similar. You will see what I mean. And, if you have had cold and flu before, you know that they have similar symptoms. And they can both be difficult to differentiate because of the similarity in their symptoms. Flu is usually worse than common cold. Cold do not result in serious illnesses, but flu does, such as pneumonia, bacterial infection, and or hospitalization. So, how are we going to tell the differences between cold and flu? So, I'm going to go over the signs and symptoms. So, signs and symptoms. Symptoms onset for cold is gradual, but for flu, bam, it just hits you. Aches is slight in cold, is usual in flu. Fever is rare. When you have cold, you don't have fever. It's very rare in cold, but it's very usual in flu. Chills is uncommon in cold, and in flu is fairly common. Fatigue and weaknesses is common in cold, is sometimes present in flu. Sneezing is common, very common in cold, is sometimes present in flu. Chest discomfort and cough is mild to moderate in cold and is very common in flu. Stuffy nose is very common in cold, is sometimes present in flu. Sore throat is common in cold and is sometimes present in flu. Headache is very rare, very, very rare in cold, but is very common in flu. So now we know the differences between cold and flu. So now I'm going to go on to COVID-19 and flu. What are the similarities and differences? Follow me. Both are contagious respiratory illnesses. They are caused by different viruses. Flu caused by influenza flu viruses. COVID-19 caused by SARS-CoV-2 viruses. Symptoms of both COVID-19 and flu are similar. They may be, and as a result, it may be hard to tell them apart, to differentiate them based on symptoms alone. So further testing will be needed to be able to differentiate whether it's flu or COVID-19. Similarities in signs and symptoms of COVID-19 and flu. Fever, feverish, chills, cough, shortness of breath, sore throat, running or stuffy nose, muscle pain or body aches, headache, vomiting or diarrhea, which can be present in children, very common in children. What are the differences in signs and symptoms between flu and COVID-19? Flu, mild to severe symptoms, or severe illnesses. COVID-19, the above mentioned symptoms, plus, minus, or plus change or loss of taste or smell. You can smell, you can taste if it's COVID-19. So I'm going to stop here because I don't want to overload the information. I'm going to make another video that I'm going to share back to back. So follow me, don't go yet.